Right now, cardiology is going through a massive shift. Instead of waiting for symptoms like chest pain or shortness of breath, doctors are using advanced CT scans, artificial intelligence, and personalized health data to find heart disease long before it becomes deadly. And the most surprising part? Some of the biggest risk factors for heart disease today aren't just cholesterol, they're sleep quality, body fat distribution, and metabolic health. In this video, we're going to explore the new frontier of heart health, including CT-first imaging, AI-powered diagnostics, and simple lifestyle strategies that can dramatically reduce your risk of heart attack and stroke. And by the end, you'll understand how to take a proactive approach to protecting your heart before symptoms ever appear. Segment 1. The shift toward early detection. For decades, heart disease was usually discovered after symptoms began. Someone would experience chest pain, shortness of breath, or fatigue, and only then would doctors start looking for blocked arteries. But today, medicine is shifting toward proactive heart care. Instead of waiting for a problem to appear, doctors are focusing on finding cardiovascular disease early, sometimes 10 to 20 years before symptoms begin. This shift is happening because of two major developments. First, advanced imaging technologies like coronary CT scans. Second, artificial intelligence tools that can analyze heart data faster and more accurately than ever before. Together, these tools are helping doctors identify hidden plaque, inflammation, and early artery damage long before it becomes life-threatening. Segment 2. The rise of CT-first heart screening. One of the biggest trends in heart health right now is something called CT-first screening. A coronary CT scan, often called a calcium score test, can detect tiny deposits of calcium inside the coronary arteries. These deposits are an early sign of atherosclerosis, which is the buildup of plaque that can eventually lead to heart attacks. The test is quick, non-invasive, and often takes less than 10 minutes. And what makes it so powerful is that it allows doctors to see actual plaque in the arteries, not just risk factors. Traditional tests might look at cholesterol levels or blood pressure, but a CT scan can show whether plaque is already forming. This gives patients and doctors a much clearer picture of cardiovascular risk. Segment 3. How artificial intelligence is transforming heart care. Another major breakthrough in heart health is the use of artificial intelligence in cardiology. AI can now analyze massive amounts of medical data, including CT scans, ECG results, blood work, wearable device data, and it can identify patterns that humans might miss. In some cases, AI can detect subtle heart abnormalities years before symptoms develop. It can also help doctors predict the likelihood of future heart attacks, strokes, or artery blockages. This means heart care is becoming more personalized and predictive rather than reactive. Instead of treating disease after it appears, doctors can intervene earlier and more precisely. Segment 4. The lifestyle factors that matter most. While technology is improving rapidly, lifestyle still plays a huge role in heart health. In fact, some of the strongest predictors of cardiovascular disease today include sleep quality. Poor sleep increases inflammation, raises blood pressure, and disrupts metabolic health. Weight and body fat distribution. Visceral fat, fat stored around the organs, is strongly linked to heart disease. Blood sugar control, insulin resistance, and metabolic syndrome dramatically increase cardiovascular risk. Physical activity. Even moderate daily movement improves circulation, blood pressure, and heart function. When these lifestyle factors are combined with early screening technologies, people can dramatically reduce their long-term risk. Segment 5. A proactive approach to protecting your heart. The future of heart health is about being proactive, not reactive. That means thinking about heart disease long before symptoms appear. For many people, that may include discussing coronary calcium scans or CT imaging with their doctor. It may also involve using wearable technology to monitor sleep, heart rate, and activity levels. But perhaps most importantly, it means building daily habits that support cardiovascular health. Small improvements in sleep, nutrition, movement, and stress management can have a powerful impact over time. The goal isn't perfection. The goal is consistent progress toward a healthier heart. Heart disease often develops silently for years, but the good news is we now have better tools than ever to detect it early and prevent it. If this video helped you understand the future of heart health and early detection, share your thoughts in the comments. What topics would you like us to explore next?